Katata curve, ka trendsetter SUV ke bawandar kalapoy ha Shillong. One ban test drive ke coupe SUV ban ninggong ekari ane pila ban phone tikin number bala ai harum.
Ka State Surveillance Officer on Rabies ka Dr. Valerie Lalu kala pentep bagi don arpnyong ngut ki breuk bala do ya ka jing na ka Rabies House Snem arhaja arflai arpusa Dr. Lalu kala ong tang mata Snem adu nailo layo jingtep ba khandru ngut ki layap na ka Jingshah Dait Ksew. Kala itu ba knai 100% na ka jingpang Rabies na ka Jingshah Dait wat la ka de ka jingpang ka bala ban sumar Hendai namar ke jing kensting ki brio ba sha Dait Ksew kim leit satya sigi jaka ai jing semar banyo ya ke jingerap kala itu ba Snem arhajar arfulai ladong khatwingut ke bayap kat ba mentau Snem arhajar arfusa khandringut ke layap na ke Jingshah Dait hakik so surok ka Dr. Lalu kala itu ba nagni ki Jingja ka West Khasi Hills bat ka Khasi Jaintia Hills ki de district ke bayap adu hendringut bat ki de district ke bontam ki bayap na ke jingpang Rabies Dr. Lalu kala pentip ru ba katanat ka kot ka khya kala shim ya ka jingpun snow thu pait ba halo ka jingpang Rabies pat ka long ba kong san pha ha borok wei ka jylla ha ka jo Khubor ka doktor kala kentu ye ki pait ba bakim dei bakin kensting ya ka Jingshah Dait Ksew wala da dei badai ki Ksew khon dei ban lek klo shi jaka ai jing sumar bat ki khrang bakin la banyo ye ki dawai ha borok ki PHC ki badon ha ka jylla Habakali halo ka sinjam jong katnat banyada ke jingpang Sha Dait Ksew kalong ba katnat kay troilang bat katnat Animal Husbandry and Veterinary bat kumju jong Shillong Municipal Board pan ai dawai ki Ksew surok ka Dr. Lalu kala itu patang House Snem arhajar arfulai palat nrus pat ligi Ksew surok lala pan ai dawai tang ha East Khasi Hills.
So we are both we are into surveillance of various diseases, and rabies is one of them. So regarding rabies, first of all, I would like to say that we've had a lot of cases of dog bites, and 96% of rabies is because of dog bites. And out of these, we've had till the last case that was reported, that was the 16th death that happened this year. So this incident is also very unfortunate because being a health professional herself, our MLHP, who's a nurse, she succumbed to this disease, which is actually 100% preventable and at the same time 100% fatal. So with vaccination and wound management at the right time, this disease could be prevented, but unfortunately because of reasons unknown to us, the MLHP could not get the congrestifol. She could not get the vaccine at the right time, and as I mentioned, rabies is a fatal disease. So once the signs and symptoms were they started to be shown in her, there was no chance of of getting back to normal. It was a progression towards fatality. So I think that is what we can say about this.
Number one, the person was bit by a small puppy. So people generally take puppy bites as something very casual. We should not take it like that. And vaccines for rabies are available at all the PHC level across the state. So please, anyone through the media, the request is that awareness that don't take any bites very seriously. And for those dog owners, please do that their pets are also taken care of. That is also very important. And this is the week which we are commemorating the Rabies Control Week program. Tomorrow, Madam and our Honorable Veterinary Minister also will be there. Along with it, we're doing a program for the entire week. It's going on across all the state. Tomorrow is the last day of the program. So do not take any bites very, very casual. Immediate attention has to be given. Immediate approach of the health facility. And rabies vaccines are also there, and medical officers are also being trained on this matter. So their consultation should be taken.
Probably lack of awareness and at the same time complacency. As sir had also mentioned, it was a bite due to a puppy. So usually we think that puppies are still sterile. They don't have any much diseases in them. We find them cute and harmless. But actually puppies, less than 2 months, they are not vaccinated. So these are at the stage where if there is any infection in them, they are most, probably that they will infect another person who's bitten.
How many cases of
Last 5 years,
1 year?
yes, we have. What happened is that rabies has been it's a notifiable disease since last year. Okay, but 2023 March. So before that, there was not much of a system of reporting and of documenting cases. Deaths were around, I think, 9 deaths that 9 to 11 deaths that happened in last year, 2023. So that was high. I think it was 11, not to be mistaken, and that was for the whole calendar year. This time it's only in the month of till September. We haven't, it's not complete yet. So we still have actually 17, but the 17th case we have not completed our investigation yet. So officially it is 16 cases of death cases. Most of the cases were stray dogs. Only 1 or 2 were their own pet dogs, but majority were stray dogs. And also because of, most majority of them were in rural areas, and also the majority of them did not receive any vaccination. So the post-exposure prophylaxis was not given to those, they had not taken after the bite. So we are currently having a very good coordination, not only with municipal corporation but also with veterinary department. We are, if you can come, you are all invited tomorrow. For the
11 o'clock.
Tomorrow 11 o'clock we're having this function. It is in collaboration with the veterinary department and also municipal corporation. We're having a program tomorrow. What we've been municipal, in fact they have dog catchers, and one dog catcher who has been doing all this, they've been catching stray dogs, and the veterinary department has been conducting these mass vaccination campaigns all across the state. So even now it is happening across the state. Yesterday it happened in Southwest Khasi Hills and East Khasi Hills.
So far, how many dogs have been vaccinated?
So the report we have for this year itself, from East Khasi Hills alone, 600 stray dogs have been vaccinated.
We have a joint steering committee made up by the chief secretary with all these stakeholders. We've already had a meeting this 1 month back. In the same hall we had a meeting. As a culmination of that, only this week is also being commemorated. Now the sharing of information, etc. also has started.